be an engineer. So as an electrical engineer, I was always working with energy, and I was always interested in the energy of the body. And I had a fascination for all things, all natural therapies, and discovered that I did look at homeopathy and aromatherapy and so many other therapies, and I found that Chinese medicine made sense to me. It was very logical. So it was the logic of Chinese medicine, and I'm going to talk about that in a second. So
this is more disruptive than if you just walked away. Possibly. It can all be edited out.
Yes, Gary will edit it all.
Yeah, I got it. So what sort of results have you had, or what are some of the highlights of since you've been doing that you've been able to?
Goodness, I've been practicing Chinese medicine for 20 years.
Yeah.
Working with all sorts of issues, with sleep problems, with digestive issues, with women's health problems. So when people come in and they're in pain, they're in discomfort, and I give them treatments, a course of treatments, we're not going to resolve years worth of problems in one treatment. As it resolves, people just feel amazing, and they go, I feel like a different person. So women who are trying to fall pregnant, fall pregnant. Women who are struggling, I do a lot of work with women's health, so women who are struggling with menopause suddenly go, oh, this isn't so bad after all. I used to do a lot of work with pediatrics, which was amazing. Not so much these days, but the pediatrics work I used to do, kids would come in a little ball of phlegm, and we'd work together with the parents, and as we resolved that, it's like my little angel is back. So it's all these little changes, pain relief, stress management, getting the body to work better so that we have the resources to cope with what we need to cope with is an awesome way that Chinese medicine works.
Great.
Yeah, it is.
Kind of linking the physical body to the emotional and
absolutely. Mind, body and spirit are one. Yeah. Chinese medicine, we don't treat emotional issues as being separate from the physical. In fact, well, I'll talk about it in a minute. The 5 elements of Chinese medicine is the foundation, one of the foundational principles of Chinese medicine, and each of those elements, fire, earth, metal, water and wood, they correspond with a different organ system, a different emotion, a different season, a different flavour. So, for example, anger corresponds with the liver. And often when we're feeling angry, that tightness, that tension that comes within the body stops any natural flow that's happening in the body. And the liver is responsible for the free flow of qi through the body. So when we're angry and tense, nothing can flow. And then we're going to get that shoulder pain, that neck pain, that hip pain, that all sorts of pains. We're not going to be able to digest properly because everything will be shut down. Sadness and grief relates to the lungs. So when we are sad, we're not breathing deeply. We're not able to take that deep breath. It's like, all of the breath is stuck up here when we're suffering sadness and grief. So by releasing the lung meridian, by using points on the lung meridian, we can just help somebody take that deep breath that allows them to let go of some of that sadness and grief that they're suffering. Worry is a classic emotion that relates to the digestive system. And again, when we worry so much, we're not digesting life. We're not processing the situation that's at hand. And so therefore, similarly, we're not able to digest and process the food that we eat. Fear is the emotion related to the kidneys. So when we're fearful, we're high adrenal. And when we're high adrenal, when we're running on adrenaline, we're not actually running on our foundational energy. We're not running on sustainable energy. So when we're high adrenal, we become more fearful, we breathe more shallowly, everything shuts down. And that's the wonderful thing about the 5 elements, is everything corresponds with everything else. So for example, When we're not breathing deeply, so that metal energy, the lung energy, we become more high adrenal. That's the kidney energy. When we're high adrenal, we become more tense, more tight, impacting on the liver energy. The more tense and tight we are, the less we'll sleep, which impacts upon the fire energy. We're not sleeping, we're not dealing with anything, we can't digest. That impacts upon the earth energy. We have no resources to cope, and that again keeps that whole cycle just falling over as opposed to flowing beautifully. So it's wonderful at bringing mind, body and spirit back into connection.
Was that the whole talk?
No?
Good.
Let's hear the talk. Okay.
I think that was a great talk.
That was a good talk.
That was really good.
Okay, so
Really interested about this lady.
this lady.
That's her story.
One of the reasons I love Chinese medicine is its holistic approach to health. So when people come in for an appointment with me, I'll sit down and I will take a case history. We'll ask all sorts of questions and I'll have an understanding of what's going on at a physical level, at a mental level and emotional level. Then I'll feel your pulses. And in Chinese medicine, the way we take the pulses is very different to just, making sure you're alive. So we've got 3 positions, actually we've got 6 positions. The upper position of the pulse relates to the lungs and the heart, so our upper body. The middle position on the pulses relates to what's happening in the digestive realm, what's happening with the liver, what's happening with the stomach. And the lower level of the pulses is what's happening within our foundational energy. So it is the kidney energy, but the kidney energy also represents the reproductive energy, our constitutional energy, our foundations. So by feeling the pulses, both hands, your body will tell me what's going on. So while consciously you've answered questions and gone, well, I'm not sleeping and I'm not digesting and I'm not doing this and I'm not on periods and I've got PMS, and it's like, okay, what's causing that? And by feeling the pulses, I can see where the blockage is or where the depletion is. I also look at your tongue, and your tongue will tell me what's going on within the body by its colour, by its coating, by its shape. If everyone stuck out their tongue here, you'd see a variety of different sizes and shapes, whether they were red tongues or pale tongues and scalloped tongues and coated tongues and geographically coated tongues. All of that tells us what's going on inside the body, and therefore we can look at how to bring the body back into balance. The foundational principles of Chinese medicine that I work with are yin and yang. So yin is the cooling, calming, moistening aspect of the body. Yang is that warming, drying, active aspect of the body. So for example, in menopause, if the yin is becoming depleted, we're going to get hot flushes and night sweats because it's as if there is too much heat in the body. We're going to experience a lot of dryness, skin dryness, eye dryness, dry mouth, vaginal dryness. All of this dryness happens because there's no moistening to the body. And the calming aspect of the body becomes depleted, and we're going to feel anxious and not be able to sleep well and all of that angst that occurs. If the yang of the body has become depleted, then we're going to feel cold. And because we're feeling so cold, our metabolism will slow down. We won't be as active. There'll be fluid retention because there's not that drying aspect of the body. And we may even put on weight. What else can happen? And we will, of course, be more fatigued. We won't have the energy to do the things we need. And that yin and yang becomes depleted, often based on our constitution. So if we've got a lifetime of being hot, doing hot, experiencing heat, eating hot foods all the time and go, do, then we're probably going to experience menopause or experience more of a yin deficiency because we've used up all of our yin. Or if we're using up all of our yang throughout our life, we're going to tend towards that aspect. That makes sense. So that's the yin and the yang of the body. I spoke already about the 5 elements. So the 5 elements, the fire, earth, metal, water and wood, corresponds with the organs and corresponds with the meridians. So the metal, currently it's autumn. Autumn corresponds with lung and large intestine. The lung and large intestine meridians, the lung meridian starts both sides, up in the clavicle region, comes down through to the thumb. Large intestine meridian starts on the index finger, comes up across to the nose. So you can see all of the meridians have a pathway, and each of those meridians relates to an organ system, relates to a season, relates to an aspect. It relates to a sensory organ as well. So for example, with the lungs, it corresponds with the nose. Come in. So if there are sinus problems, if there's hay fever issues, we go, okay, what's going on within the lung region? The immune system, of course, we're breathing in all of those germs. How can we strengthen the immune system? The lung rules the skin in Chinese medicine, so when skin problems come up, we'll be treating the lung energy, plus all of the other meridians that, play a factor in there. So for example, part of sinus issues is all of that phlegm. Where's that phlegm coming from? The digestive system. Either the foods that we're eating are not working for us, or we're unable to digest those foods appropriately, and that will create a whole bunch of phlegm, which then ends up sitting around in the sinuses or elsewhere in the body. And the nervous system, we've spoken about being able to breathe deeply in order to keep that nervous system calm. With the emotion of sadness we've talked about, there's also the body clock in Chinese medicine. So every 2-hour period of the day corresponds with a different organ system. So the time of the lungs is between 3 a.m. and 5 a.m. So all of those people that wake up at 4 in the morning go, why do I keep waking up at 4 o'clock in the morning? Well, invariably we'll feel there's an imbalance in that lung pulse, or there's something going on at the level of the lungs, a grief, a sadness, a disappointment that's waking them up, too full of phlegm, you'll start coughing, sleep all through the night, but I wake up coughing at 4 o'clock, because that's the lung time. That time between 5 a.m. and 7 a.m. is large intestine time. So that's why we often talk about, we get up and have our morning constitutional, go to the bathroom, let everything go. And when things don't go so well, when you're feeling constipated, feeling stuck, when you're hanging on to life or whatever's going on there, well, one of the things that can help is our lovely proper stools. So our lovely bathroom stools. So sitting at an angle helps to move the bowels. And also being well hydrated. So it's important to be hydrated, it's important to drink not just enough water, but good quality water, which is why I love our Zazen water filter there that not only takes all the crap out, but puts a lot of good stuff in through the mineral stones. So there are flavours as well, so each organ system will have its own flavour. So the flavour of the lungs is the pungent flavour. So things like shallots and fresh ginger and chives and leeks, awesome thing to have in springtime. So one of the very first recipes that's in our Materia Medica is a shallot tea. Because when you've got a cough, when you've got a cold, you want to disperse that energy up and out. So that pungent flavour helps disperse things up and out. So that pungent flavour is wonderful for the lungs. Okay, so once I know what's out of balance, then I can dig into my toolbox. And my toolbox contains acupuncture, moxibustion, because mox is a wonderful way of warming up the body. So I can either warm the acupuncture points or warm the whole meridian or warm the centre. Warming up the belly is a wonderful way to go. Moxibustion is a herb. It's Artemis vulgaris, so it's of the chrysanthemum family. And it basically looks like a cigar. I should have brought some out, but I get some later. So there's many different ways of using moxibustion. The way I use it is the cigar sticks, and we just will hold that above the skin, above the acupuncture points to warm those areas. So it's very good when you're feeling cold, or you're feeling depleted, or you're in pain, because invariably pain is stagnation, and warmth will encourage movement to occur. So we want to get things moving. So there's the needles, there's the moxibustion, there's the cupping and the gua sha. So everyone's seen the Olympic swimmers that all have their octopus kisses down the back. That's the cupping. And cupping is about drawing out stuckness, drawing out pathogens. So you can have cupping when you've got colds and flus. You can have cupping when you're in pain. Gua sha very similarly works at releasing and drawing out that stagnation, but it's more about scraping. So you've probably seen all the wonderful gua sha tools that you can buy for facial work, which is lovely, but gua sha is also very good at releasing by scraping through. You end up with tiger stripes rather than octopus kisses. So they're the primary physical tools that I work with in clinic. I will also work with herbs, so we've got pilules, capsules, granules that you can use to make teas, and I have some raw herbs, and some of the raw herbs like red dates and goji berries and longan and dongguai, women's herb. So one of our teas here is a red date, goji berry and longan tea. Very good for nourishing the blood. There are also some wonderful herbs, of course, for releasing pathogens, so for colds and flus. We've got herbs, dietary advice. You will not leave my space without me talking to you about food, because diet is the centre of everything. It's our resources. If we don't have the resources to heal, we can't heal. And so much of what goes on within our system is based on what we're eating, when we're eating, how we're eating. So we'll always talk about dietary advice. And lifestyle advice, so stress management. So when you're going to sleep, you know, a lot of people say, oh yeah, I'm getting my 8 hours of sleep a day. I go to bed at 2 and I wake up at, 10. It's like, well, yeah, the quality of sleep. You know, a lot of research, Chinese medicine research and Western medicine research will tell you that the most important time of day for you to get some sleep is actually between 11 p.m. and 3 a.m. If you're only going to get a few hours sleep a night, that's when you're going to get the most restorative sleep. So we talk about lifestyle issues when you're in the clinic with me. So depending on what's going on for you, whether you've come in for aches and pains, whether you've come in for menstrual issues, menopausal issues, how long you've had the problem that you come in for will depend on how long it might take to resolve the problem, to resolve your issue. So for example, with menstrual problems, it'll often take about 3 cycles before you can sort of go, yeah, this is amazing, I've changed. A lot of women will be changed within the first period, but it's usually 2 or 3 periods before everything sort of goes, yeah, this is making such a difference. Menopausal problems, I'll say come in for 6 weeks in a row, 6 weekly sessions, and you'll then notice a big change, as long as you're also doing what you need to do at home in between visits. Aches and pains, if you've got chronic aches and pains, if you've had those pains for years, it might take months to resolve. If you've had those pains for a couple of weeks, one treatment might see things shift. So it's very difficult to say how long is it going to take to treat. That's pretty much all I had to say. So any questions about that or something entirely different to do with Chinese medicine?
Tell me more about skin issues, how you would go about treating, like say eczema or something.
Okay. The way Chinese medicine sees eczema is we see that as phlegm is blocking nourishment getting to the skin. So 2 aspects of that. We have many different types of eczema. It'll be either weepy or very dry. When there's a lot of weepiness going on, that phlegm is more apparent. So we'll certainly be looking at diet and herbs to try and dry up some of that phlegm, as well as acupuncture points that will clear that phlegm. And that phlegm, as I mentioned earlier, comes from the digestive system. So by shifting some of the diet away from phlegm aggravating foods, that will help, and then strengthening the digestive system so that it can process everything well and therefore not create as much phlegm because it's digesting well. There's also a lot of heat. All of that itchiness is heat that's coming up in the body. So again, we can use acupuncture points that will help clear the heat, help bring everything back into balance, and we'll look at diet and herbs to help clear the heat out of the system. As I said earlier, the lungs rule the skin. Come on, look. So because the lungs rule the skin, a lot of the acupuncture points we use will be points on the lung meridian. Because, as I said, all of that phlegm is connected to the digestive system, we'll be using points along the spleen and stomach meridians to help resolve the phlegm issues, and possibly points along the large intestine channel or the Sanjiao channel to help clear some of the heat in the body. So there is no one size fits all about Chinese medicine, which is why I love it. So when you come in with eczema, I will be asking, what's your experience of eczema? How is it manifesting for you? What is your diet like? What is your lifestyle like? Where is it showing up? And what is your body needing? Because by feeling those pulses, your body will tell me, no, I'm just stuck. Or actually, I'm just massively depleted. Or I am absolutely so full of phlegm, it's not funny. So I will then know whether we need to drain you, or we need to nourish you, or we need to move things, or we need what we need to do, I will work out from your body.
You know when you were talking about the cupping and the other, what's it called?
Gua sha.
Gua sha?
Scraping.
Scraping. Yeah. Does that work on a meridian level, or does it work on a lymph level, or what is it? Is that movement? What is that kind of doing?
In Chinese medicine, we've got the 12 primary meridians that most acupuncturists will work with. However, the meridian system is not restricted to the primary meridian. The meridian system also has what's called the sinew channels, the divergent channels, the low channels, and the 8 extraordinary vessels. The sinew, the primary channels are quite thin. I might get in trouble for saying something like that, but they're quite specific. So you've got a specific acupuncture point that's on each meridian. With the sinew channels, it's more areas of impact. So while you might diagnose a pain issue, particularly using various movements, so whether it hurts more on extension or flexion or rotation, that will give us an idea. So for example, it hurts more when I turn, we'll say, okay, it's probably within the gallbladder, triple heater, sinew channel. Therefore, working that gallbladder sinew channel, it's not a matter of this point and this point and this point, it's a matter of an area. So scraping through those areas will help release that stagnation. Yeah. So it's very different. You're working deeper than the meridian. You're working, the sinew channels as opposed to the primary channels. Yeah. So it's a slightly different.
So are these channels or these areas and channels and all those 8 special vessels or whatever, they're not like in layers, but are they in layers? Like how do they kind of exist in the human form?
We say that the sinew channels, it is the wei qi, the defensive qi that sits within the sinew channels. So they are going to be much more superficial within the body. Mm-hmm. The primary channels tend to run at the yin level, the nourishment level of the body. So they are slightly deeper. And then the divergence, the 8 extraordinary vessels, are quite deep within the system. So we're working with our foundational energy, with our constitutional energy when we're working at that level. What have I missed? Sinews, primary. Oh, the lower levels. The low channels are numerous channels. You've got transverse low, longitudinal low and transverse low. Those low channels are the channels that actually link everything together. So, we talk about pairings. The large intestine is paired with the lungs. How does that happen? Well, apart from the fact that the energy travels down to the thumb and then comes across and works up, there's a channel that actually goes between the large intestine and the lung, and that's the low channel. And the low channel is actually where we store a lot of our emotional stuff. So all those little spider veins that pop up, that's part of the low system. Our body takes on board a pathogen, usually, it's more an emotional pathogen, a cold shoulder or a disappointment in life or a shock and that's impacted upon us. We take that emotion on board, and if we can't process it properly or appropriately, or we don't have the time or the headspace or the capacity to process that emotion, our body goes, okay, well, I'll store it for later. And it then starts showing up as all the little spider veins. So bleeding those points in a particular protocol with the low points and the low channels will help to release a lot of that emotional stuff. Does that make sense?
Yeah.
Yeah.
Because with the throat,
Mm-hmm.
is it the lungs? Is it the digestive system? Is it the throat itself?
What's happening?
A dry cough for
Okay.
months and months and it came after I had COVID and it's never left.
Okay. So as a cough, we
Yeah.
would say, yes, it's something happening within the lungs. When you're in the throes of COVID, we say there's an external pathogen. We know that there's an external pathogen coming into the system. Please come on in. Come on in. You can stand in the back, or there's a seat here.
It's busy.
So, so when you've got a cold or flu or a virus of any description, we'll be treating that Wei Qi level, that superficial level, to help clear the pathogen. If it's not treated in a way that the body is happy, so appropriately that the body can cope with everything, that pathogen can sink deep down into the body. It can deplete aspects of the body. So for example, with a dry cough, it might be that the yin has been depleted. Maybe there was a lot of fevers during the COVID. Those fevers, that heat, would have burnt up that moistening, cooling aspect of the body. Now the yin is depleted. There's not enough cooling, calming, moistening aspect. And the lungs, the lung yin needs to be nourished. And by putting moisture back in, into the body, we're helping to sort out that dry cough. So yes, so when we've often been sick, we can deplete an aspect of the system, which is why these coughs linger. Or sometimes when we don't have the energy to throw that pathogen out, that like opportunistic, herpes and things, when you get sick, and it's like every time I get run down, the herpes comes up because the herpes virus is sort of sitting within your system. That's what we call lingering pathogenic factors, and we can help the body release those lingering pathogens as well with herbs and acupuncture.
Thank you.
When you release them, where do they go?
Out of the
Do
body.
you weed them out? Or does it come out of your breath? Or does it come out of your skin? Or
It can come out through, I suppose with viruses, things like that, we're sweating them out more often than not. We'll sweat out those pathogens. With emotions, we'll bleed them out. It'll come out with the blood, because the blood is what stores our spirit, our Shen. We say that the emotions are in the blood. With the phlegm, it might come out through the stools or by weeing out a lot of the fluid that we retain. It might come out through tears. So, crying it out. I've had a couple of patients where, you pop in a pin and they just burst into tears, and it's like, well, no, it doesn't hurt, but, all of a sudden I've been able to let go of what I'm hanging on to. So it comes out in various ways, depending on what it is you're trying to let go of. Sometimes it can just come out gently and in your dreams, or your body just transforms that energy into something more useful, or something that you're able to poo out, pee out, sweat out, cry out, spit out. So yeah, lots of, depending on what you're letting go of, it'll come out in different ways. Does that make sense? Does that answer your question? Any other questions? No? Awesome.